Uh, Not seeing other councilors, but Chief Mann, I understand you have one item on the agenda.
Yes, sir, Councilor Majuk. I have one item.
Okay, go ahead.
Okay, this item is for the Syracuse Fire Department to receive a donation from National Grid for up to $50,000, and this is money that's going to be used to buy 3 new detectors for natural gas. And also National Grid is in town over the week, and they are providing updated training on responding to natural gas alarms. So our fire department, anytime there's a 911 call that's related to a smell, odor, or an actual natural gas break, we respond to those alarms, and this training is very beneficial. And National Grid has agreed to donate $50,000 worth of equipment and training. So that's what I'm requesting, the authorization to move forward with this.
That's great. Councilor Driscoll, do you have any question on this?
Sorry, Chief, I missed it. How much is it?
It's for $50,000, and we estimate that the cost of each of the units that they're going to donate to us is around $15,000 to $16,000, and that's where that $50,000 came from. So a little bit under $50,000.
Right.
So they are paying for everything, right, Chief?
Yes, they are, and we work closely with National Grid. We arrive on scene usually way before they do, and we identify what the issue is, if it's a natural gas alarm, and then they come and we actually turn the scene over to them, or sometimes they call us to help them with mitigating a hazard if it's a natural gas leak, and our hazardous materials teams would go and we stop leaks in different types of natural gas distribution systems. So this is a good relationship, and we're planning on doing more of these types of partnerships with National Grid, and it's very beneficial.
Okay. Councilor Driscoll, anything? Okay. All right.
Okay, thank you.
Thank you so much.
Thank you, councilors. Have a good day.
You too. Chief Cecil, you have 2 items?
Yes, hi, Councilor. So the number one item is to contract with a psychological group. It's the group that we've used year after year to do our psychologicals for our academy recruits, meaning the candidates that are applying to become our recruits. We take them through psychological analysis. This group, the reason we continue to use this group is the director is one of only a few psychologists in New York State that's board certified for police and public safety psychology, and the former director as well was certified by DCGS for psychological analysis for those specific items, police and public service. I'm sorry, police and public safety. So we use this group. It's for $20,000, the contract, although sometimes we don't use the whole amount. They cost $350 per evaluation. So depending on how many candidates we have just before we hire them, this is one of the last stages of the hiring process. Depending on how many we have left, we may not use that entire amount, but that's what this is for.
Now, Chief, is he a city resident at all, or just out of curiosity?
No, sure. No, this company, this group, it's a whole psychological group they're in Albany. They're from Albany.
Oh, okay. Because I saw here Dr. Keller. Is it Dr. David Kelly, right?
Yes, that's correct.
Okay. And now, did we nothing here in our town? Because I'm asking with the understanding that we sometimes don't have that. We may run into a trouble of specialists. So do we have nothing around here for that to provide us that kind of service inside the city of Syracuse?
We have looked, Counselor, and I will say this. I know this is a waiver, which we try not to put forward these waivers to the RFP, but we're kind of under a crunch here. We're going to try and hire in July. So I think we'd run out of time, but when our next academy comes up, we've been approved for a second academy. We can put this out to bid. I have a feeling this group is going to win because of their expertise. You hardly ever see these credentials anywhere, but to your point, there could be somebody more local that has these credentials. I just don't think we have the time I know we wouldn't have the time for this academy coming up, but next time around, we could certainly put it out to bid to see if there's a local psychological association around that can do it.
Yeah. Yeah, I get that, Chief, and I think I think there is a trend here in especially for us counselors, especially for me, that if for any contract, for any resources going out, I really would like us to start really thinking in terms of always utilizing our city folks first before we go out. And you know, sometimes folks are just looking for opportunities, Chief, and they could do just as much of a good of a job as somebody that has been doing that for a while, and we should be grooming our own, you know.
Okay, understood.
So Councilor Driscoll.
Yeah, that's great points. I concur.
Okay. All right. Next, Chief.
Sure. So number 2 on the agenda is we're asking for permission to enter into, or at least apply for a grant in the amount of $25,000 from the U.S. Conference of Mayors. This is a very unique grant that came our way just a few weeks ago. That money would allow us to buy 10 iPads that the officers could carry around. They would probably be officers that are already certified CIT officers, crisis intervention training officers. They would carry this iPad around, but when we go on mental health calls, in certain circumstances where we could connect the person going through their crisis with a mental health provider that has more experience and expertise than us. We are going to partner with Liberty Resources, and we would actually do just that. So if we had these laptops, we'd go on what we're calling now a PIC, a person in crisis. We would do an initial evaluation. If it was the type of case where we could get their caseworker on the phone, get somebody from Liberty Resources, not on the phone, on the iPad, and let them engage with this person to see if they could get them the services they need. So it's just one more level of trying to handle these mental health crises or mental health
Councilor
calls.
Driscoll. So
Yeah.
this would be the intent of this is for officers to carry it, and it's going to be 24 hours kind of thing, right? So say people that work officers that work in third shift would be able to also use this to dispatch mental health staff or personnel.
Absolutely. We would either distribute them throughout the shifts or have them where they could just pick them up on their way out the shift, because they can be used. They're not like body cams. They can be used by multiple officers. Obviously, it's just an iPad. So yes, we would make sure this opportunity was available for every shift.
Okay.
And so what would be the data collected there, Chief? What would be the advantage? I'm a bit confused. So they would have these iPads, and then it would help them identify or connect to resources.
Yeah, exactly, Counselor. So say we go on a person in crisis, again, that's what we're calling it. We don't call it EDP anymore, emotionally disturbed person. But we go there, we find someone that's going through some mental crisis. Obviously, we wouldn't be able to use this if they're doing something violent or have weapons, but say they've calmed down to some point and they're talking to us about medicine and they don't know how to get this and they don't know how to get that. It's certainly beyond the police officer's scope. So he would get either their caseworker on this iPad or somebody from Liberty Resources right on the iPad, hand it to the person, let them start talking to them about services and try to, give them the best possible chance of getting those services or calming down or whatever.
So the concept would be they could have like a digital interaction with Liberty Resources on the spot should they need to.
Yes, it would be live time right then. Yep.
Oh, that's great. Yeah, that's really great. I don't know if all my fellow counselors are aware, but we've been, I've been in frequent conversations with Liberty Resources that they're moving to a 24/7 model within the coming months to help supplement the police's work on this stuff, particularly for people, as we're talking about people in crisis, people with addiction issues, mental health issues. Liberty Resources will be there to help assist the police in all these situations. So yeah, this is a great additional resource that sounds like it'd also be very helpful to provide that kind of counseling in the moment should they need it as well. And how
Chief,
much? Sorry, Chief. How much was it again?
It's, we would apply for $25,000 for 10 iPads. Again, there would be no match required.
Oh, great.
So Chief, a counselor would actually be on the site of the community member, right? So say if officers send this, they would drive from where they are to the person, or is it just
No.
submitting information, letting them know?
You would be getting them on the iPad. So you would get a caseworker on an iPad to talk live time with the person going through the crisis. Now, in some cases, and Councilor Driscoll is correct, Liberty Resources are already shown to be a great partner for us. They have been able to respond right to the scene on many occasions. And when they go to this 24/7, that will only increase. But there will still be those cases where they are an hour away, 45 minutes away. Being able to get somebody right on a live iPad and talk to the person will be valuable.
So this would be like a FaceTime, okay, right? FaceTime kind of thing?
Yep, exactly.
Okay. Councilor Driscoll, thank you, Councilor Peñao, for joining us. Yeah. Okay, that would do it for us. I ask for a motion to move the item, Councilor Driscoll and Councilor Peñao. Yes.
Certainly, they all sound very good, very exciting progress. Hope they all come through.
Yeah. All right. That will do it for the committee items. Raynette, thank you, Chief Cecil. Raynette, we had spoken yesterday and then prior about you coming back here to just talk a little bit more about your investigation position and possibility of funding that position. You want to run us through that again, just briefly, just over a little bit.
I believe we talked in detail yesterday, so I'll just only add a couple of more things in terms of a caveat. For requesting a full-time position rather than allocating more funds to just the private investigator that we have now. Is just to think about the fact that when looking at which cases we can provide to a private investigator, we are having to, review that information and make sure that it's worth us giving it to somebody who we're going to be charging. We're going to receive a bill of $50 an hour. So we're being as you would say, stewardess in our decision in terms of what cases we feel should go there. So that we are looking at those cases. And then again, when you look at that is sometimes the reason why, those cases aren't being sent there, because, we don't want to utilize funds for cases in which we don't believe there's a lot of footwork and things of that nature, and where we need those additional expertise. One of the requirements that had been previously said was that the private investigator have prior law enforcement background. That is what we have currently going on with the private investigator, but we also don't want to be frivolous in how we spend that money as well. And in terms of when you look at whether or not we want to start having board members to do more investigations, we want to look at whether or not that allows them to still remain impartial. So when they're just getting that information, from a case summary and reviewing the reports that are being provided by myself and the police department, that impartiality is clear. When you start having them, go out into the field like that, you run the risk of them not being impartial anymore, because now they have already a set aside opinion. Based on that. I'm not saying that necessarily would happen, but I also want to point that out. And, that would be a concern as well. We talked about some of the training concerns. I'm not saying that the board members have not received good training, because we have utilized the council in the past to provide food for trainings, and we do our best to spend We spent money for Bob Stewart to come in, which was a national consultant to come in, and we look forward to using him again for some training. And we've also, attended the police academies, civilian academy as a way to utilize that. And I am able to provide them with the information that I get from the training. But again, I've gone to internal affairs investigation training. I've actually gone to the advanced internal affairs investigation training, for which my board members have not. So there's just a different level. And when we talk about these investigations as well, it's not as if I'm still not going to have to review the investigations. I'm not really passing the buck, because after they complete their investigation, I need to make sure that investigation is complete. So it isn't as if when you talk about the funds that were previously allocated to increase the administrator salary based upon the workload and things of that nature, I'm not really divvying up workload, because I still have to review it. So even when the private investigator does it, I review his investigation. Even when we hire, this full-time investigator, I'm still going to have to review that and make sure that we have all the sound information. Even before we assign those cases again to the private investigator and to an investigator, we are getting medical records. We are getting, making sure we have all the necessary footage, witness information, and things of that nature. So I'm still doing all of that, myself and my one full-time office staff. So I just want to put those things out there as some additional information for you to consider as to the need for a full-time investigator.
Thank you, Ray. Councilor Driscoll, Councilor Paniagua, do you have any follow-up question for Ray? As you know, we had a very extensive discussion yesterday, but I just wanted to bring it up because we were a little bit running behind on time, so we couldn't. If there was anything that need a follow-up, this is the time to do it. Good?
Nope, I'm good.
Okay. Ray, thank you so much. Thank you for elaborating those stuff for us.
Thank you so much for the time.
Yeah.
Have a great rest of the evening.
All right. That will do it for us today. Have a great day. Take care.